Hello, everybody. My name is Dr. Zhang. I'm an internal medicine physician and a prior researcher. Today's topic is the long haul COVID, what we can learn from chronic fatigue syndrome. Today, I want to talk about a condition bearing a lot of similarity to long haul COVID. By this comparison, I hope to shed some light on long COVID as for how to treat it and what's the mechanism of the disease. Let's look at the symptoms of a chronic fatigue syndrome. In these slides, you can see common symptoms including sensitivity to light, headache, tender lymph nodes, fatigue and weakness, muscle and joint pain, inability to concentrate, insomnia, forgetfulness, mood swings, confusion, low-grade fever, and depression. So official diagnosis is called myalgic encephalitis/chronic fatigue syndrome. I do not particularly like the term myalgic encephalitis because it wrongly points to the direction of inflammation of the brain itself. I do not see any evidence of it. But what do you see from these symptoms of chronic fatigue syndrome? I would say very similar to what we experience with long COVID. Most likely, most long COVID patients will eventually be classified as chronic fatigue syndrome. Since chronic fatigue syndrome has been around for a long time, I hope that this can help us finding some solution and guidance as for the cause and treatment options. It may also serve as a reference for how long COVID will evolve and what is the prognosis. These slides point to some basic facts about chronic fatigue syndrome. Chronic fatigue syndrome was considered a condition in many people in their head for a long time, and it has not had a physiological diagnosis for a long time. Finally, it is recognized as a physical disease. Here is the diagnosis criteria. I'm not going to go into it, but you see we have a final diagnosis criteria. Medical students are still not taught in their education. The illness is often misunderstood and might not be taken seriously by some healthcare providers. But there is a large number of the people who suffer from this. It's estimated that about 836,000 to 2.5 million Americans suffer from this condition. So about 80% of people with this condition are undiagnosed. It happens 3 times more in women than men. 80% of people had a viral infection prior to the onset of the disease. Chronic fatigue makes activity of daily living very difficult. Some people has been bed-bound. There is no diagnostic test for this disease. There is no cure, but it can manage symptoms. In the prognosis, only 5% of people had a total resolution of symptoms. I'm telling you that I have gone through large numbers of publications on this topic. I will gradually put out more information about them, particularly the involvement of immune system abnormality, inflammation, and mitochondrial dysfunction. I will also try to figure out is there any treatment options. In review of this current information, I still believe my previous videos about the long COVID treatment is accurate. With the prognostic information from chronic fatigue, I believe it is imperative to start a comprehensive treatment similar to the video I outlined. I also suggest start treatment ASAP so we can prevent the full-blown chronic fatigue syndrome. Thanks for listening.